Just imagine this. 7 children die every hour from this preventable disease. And the fact that this is preventable adds a very tragic dimension to the whole issue. Preventive because vaccines are available, because with creating awareness among the people, creating mass awareness about the disease, we can mobilize our resources and whatever resources are available to prevent the deaths. I appeal to all in every position of society, civil society members, professionals, experts, to come together, to forge an alliance, to prevent the deaths which we can.
This was indeed a new experience for me because I didn't know about the acute problem of pneumonia in our country, and I'm glad that I came and I could hear the problems and what they're planning to do for Bangladesh, and I hope to cooperate fully. I think that the most important thing is to develop awareness among mass people about pneumonia and how to get to the health care, and I will do my best to do that. Because I have an organization of my own and I'm doing works with, I'm working with the children and to develop awareness among the children, and through the children with their parents and their neighbors, and by this we can develop the awareness about pneumonia.
Okay, actually I'm here for the first time in a scientific presentation of regarding to medical science. Actually this is not my field. I'm really surprised to get various data on pneumonia because I'm actually in a learning process. I'm from a construction sector. I'm a civil engineer. I have had no idea before regarding pneumonia, but when I heard about the data, I'm really worried that the government should take proper steps from the parliament or from the policy makers. Some steps should be taken to prevent such pneumonia. Well, actually, because I am representing the business sector, the awareness can be started from the business bodies. There are various business bodies in Bangladesh, and if they observe in their fair or in their offices, if they do the awareness program within their staffs, their employees, I think it can work good. And at the same time, definitely we will be needing some data as how to approach and how to approach regarding the awareness of pneumonia. So, if we get those data, I think in our offices and in our construction workers field, because a lot of women and little children, they are also involved in the construction sector. We can take part if we have some data. Yes, I think this is the right time that we should start doing something, because in every minute we are losing 7 lives.
It was stunning. I didn't really know much about pneumonia, and I didn't realize that it was such a killer. So I think as a person from media, we would like to get more and more information and human interest stories about pneumonia and its impact on human life, on people, and the sufferings and also the causes, so that we can write and influence the general people and also the policymakers, so that they can bring about changes, I would say positive changes. You know, generally speaking, the role of media for anything is the same. We work to inform people, to educate, to influence. Now, so through education, you can also have a preventive impact. Through influencing the policymakers, we can bring about such decisions which actually help, if not eradicate, but lessen the problems and also maybe prevent these sort of diseases.
First of all, we are living in a country where in every hour 7 children are dying. We don't know about that. So it's big information for us as a media people, and I believe that it will help us to create more awareness in the country. As a media people, we can create a lot of awareness in the nation, and what we can do, because we feel that this is such a disease which is not actually created attention from the policymakers. And if we media can play our role properly, I believe we can create awareness in the nation, as well as we can create more policymakers should be more active in this field. Actually, we don't know enough about that earlier. The recent conversation with Dr. Shamir and other people, that what we find that it is one of the most disastrous situation of the country, and every hour 7 children are dying. It is such a disease, we don't know enough. So this is the thing I think we can, media people can create awareness, and these are the things actually which you can prevent by creating awareness, and media can play a good role on that issues.
I think it has been important, and perhaps for the first time, although pneumonia is a major killer in this country and in the developing country, but then to develop a total awareness and then handling the problem, this kind of initiative I think is very praiseworthy. And I would consider that, you see, this raising awareness about pneumonia will be cross-cutting a lot of issues of the problems of children in this country. So when a child suffers from a pneumonia, he does not only suffer from pneumonia, probably he suffers from malnutrition as well. And then perhaps that child had really been deprived of the proper food, like breastfeeding and proper complementary feeding. And these are the important preventive measures that someone can do to prevent pneumonia. A child who is breastfed, he has got 25 times less chance of dying than a child who is bottle fed. So therefore, you see, it is one of the major preventive measures, that is the breastfeeding, which can really save a child from getting pneumonia. And then once the child will be getting pneumonia, and if the child is breastfed, has got a very high chance of survival. So these are the few things. One is breastfeeding, another is the proper complementary feeding. Complementary feeding really means when the child is given some other food besides breast milk in the family, when the child is 6 months of age, and then the proper complementary feeding is being continued along with breastfeeding for the first 2 years of life. So another thing is important preventive measure is hand washing. Hand washing in recent research study had shown that hand washing alone will be preventing 20% of pneumonia, because through hand the germs are contacted and then it's spread to other people. So therefore hand washing will be another very important preventive measure. Another thing would be to look after the mother when the mother is pregnant, and during pregnancy if she is given proper food, then the child will be of better birth weight, and if there is better birth weight of the child, that is also going to prevent pneumonia to an extent during the period of infancy. So I would consider that pneumonia is largely a preventable disease even in a resource poor country like Bangladesh. If we really pick up the risk factors, and then to address these risk factors are not difficult, within our own resources, within our own human resource, in terms of financial resource and environment wise, and also the drugs that are available, and also the capability of the mother to look after the child, I think we can largely prevent pneumonia. Well, I would really consider the most important thing is to promote, protect and support breastfeeding and proper complementary feeding. This will be my primary role, because by doing this, and when this is in place, we will largely find that hardly children are getting pneumonia and hardly the children will be dying from pneumonia. So that would be our primary, preventive measures that we would like to consider.
I can say I'm not a medical man. I studied physics, and now I'm the Vice Chancellor of a public university called Jagannath University, which has got 25,000 students. Coming to this conference, which is a global coalition against pneumonia, I have learned many things. This disease, which causes death to the children, and the number is so high. I'm really amazed. I didn't know that. In Bangladesh, 7 children die every hour. That is a very sad thing. We must be doing something to prevent that. It's duty of everybody, all of us. And to do that, we must also consider what are the measures that we should take, whether we should, the doctors have here, Professor Talukdar has suggested some ways. If these measures can stop deaths, we must adopt these measures and make everybody aware of these measures. And to do that, I declare that I join this fight together with my students to make people aware of this disease, and we should take measures to prevent this disease, and also if this disease has occurred to some child, and what measures they should be taking. So I would like to say that these sort of things should not continue. It's not because we should abide by the Millennium Development Goal or something like that. It's the death of the children which we cannot allow in these days. We should take all-out measures, all possible measures to stop this. That's my view. That's what I have already stated briefly, that I can do all I have to do. That is, together with the people I work, that is, I have got 25,000 students in my university. And these students have got their relatives and parents and everybody. Together, maybe hundreds of thousands. I can make them aware of this disease and the killer instincts that this is having. That means the effect that this disease is having to our children. That is, it is killing 50,000 children a year. It is a colossal number. We must not allow that. So, I can make my students aware of the fact and ask them to go and discuss these preventive measures in their family and to the people they know, so that this will help preventing the disease and occurring death.
I think it's a very timely initiative that we're all very proud to participate in. Well, ICDDRB has been at the forefront of research in respiratory diseases in this country, together with other institutions like Shishu Hospital. So we feel that this is the moment also to make it more widespread, as happened with our real diseases many years ago. This is a whole new initiative of awareness and need for saving lives through another system.
2nd of November is the World Pneumonia Day. Professor Sumit Saha has raised the questions and properly raised the issue about the mortality and involvement of the pneumonia in our country. When we consider Bangladesh, we always think this is an area where diarrhea is very predominant. Of course, diarrhea is predominant in our country, but another portion, about 1/3 of our children, they are suffering from pneumonia and respiratory tract disease problem, which can be easily prevented by different process, by immunization, by improving the health, by breastfeeding. So, Professor Sumit today raised the questions about the importance of this today's and extent of the problem. So, along with this, we'll also raise the issue how to prevent these things, because these are the preventable diseases. So I thank Professor Sumit Saha, and if with this program, if we go ahead with this program, probably in future we can control the disease, we can fulfill the Millennium Goal for our children.
No, I thought the presentation was very interesting and very insightful, because a lot of the basic information is not available to the general public. So when experts talk about it, when doctors give real figures, it certainly creates an impact. But I think there's also a danger in Bangladesh that the numbers game doesn't always yield the type of response that you would like to see. I think we have so many statistics. 5,000 people die every year on account of road accidents. 500 people have been killed on account of custodial deaths. So we also have to put real life situations. We have to record case studies of individuals. I think that might make the message much more powerful. And as far as what we can do as an elected public representative, I've already raised the issue in Parliament. So it is in the radar of the government, it's in the domain of the Parliament. And the Honourable Minister for Health has also made a commitment in the House of the Parliament that he is going to look into the matter. So we have raised the profile, we have reached out to some of the policy makers, and hopefully it will lead to the sort of results that we are all hoping for and wishing for.
The pneumonia, which is the greatest killer of child, it is more than all the other diseases in the world. So the prevention is vaccine first, vaccine second, vaccine last. There is no other alternative. Through vaccine, we have eradicated polio. Through vaccine, we are eradicating measles. Through vaccine, we are eradicating hepatitis. So through vaccine, pneumococcal vaccine will eradicate pneumococcal pneumonia as they are doing in the other parts of the world. I can convince the people, I can convince the government, I can convince the intelligentsia to speak for me, to speak for the little kids, to speak for the children. As a senior pediatrician of the country, this is my moral obligation to look for the welfare of the children. That's the only message I can give you.
We are gathered here today to learn about pneumonia, to exchange opinions and thoughts and ideas about pneumonia. And the reason is that pneumonia kills more children than any other causes, about 2 million a year around the world, and in Bangladesh at least 50,000 every year, and maybe a lot more than 50,000. For the first time, the world and Bangladesh is observing the World Pneumonia Day on November 2nd. And we met here today in preparation for that event and for that day, so that we can raise awareness. I was very happy to be here and hear from everybody around opinions of various kinds. And the most exciting was the enthusiasm and the excitement that was generated. I hope we can continue this dialogue, and hopefully that we can do something effective in terms of preventing pneumonia and in terms of preventing pneumonia deaths. Thank you.
Well, the presentation is nice, but the thing is this pneumonia is really a very deadly disease in our country. It is a very deadly disease in the poor countries. But the thing is this, we must make the vaccination for the poor people very easy access to them, so that the poor people can get the vaccination, because the vaccination for this disease is very costly. So for Bangladesh, since I'm a citizen of this country, I must say that we must make the vaccination very easy for the poor people, and that's all.